Hello, everyone, and thank you for joining us for this special edition episode of Healthy Dose of Dialogue podcast. We've gathered insights from industry experts about the evolving landscape of mental health in the U.S., where it's estimated that 44 million people suffer from mental health issues. Did you know roughly 1 in 5 adults will have a diagnosable mental health condition at some time in their life? We spoke with industry experts and thought leaders on the podcast about mental health, including Patrick J. Kennedy, former U.S. House of Representative and founder of the Kennedy Forum. Patrick is a strong advocate that mental and behavioral health care have the power to solve some of the country's most vexing physical and societal ailments.
It's the truth. You know, our system of healthcare is not acculturated to treat mental health and addiction in the same way as they treat other physical illnesses, but that's changing.
Patrick was the lead sponsor of the 2008 landmark Mental Health Parity and Addiction Equity Act, a law that requires insurers to cover treatments for mental health and substance abuse. He describes the act as a foundational first step for accessible care.
This really is about health equity. In a sense, the parity law was a medical version of civil rights. It's basically saying people who suffer from brain illnesses shouldn't be taken care of, in a substandard way.
Each year in the U.S., mental illness costs $200 billion. And despite this hefty sum, only 1 in 3 patients diagnosed with a severe mental illness receive adequate treatment.
When it comes to both mental health and substance use disorders, there hasn't been that much experimentation with new payment models.
Catalyst for Payment Reform Executive Director Suzanne Del Banco said many patients have limited options because mental health isn't integrated into a patient's primary care. Mental health services can also be siloed between providers, hindering collaboration. During the COVID-19 outbreak, she said her group noticed the problem only intensified.
Before the pandemic, our members were already seeing an increasing need, quite steep, for both mental health and substance use disorder care. So the pandemic has just exacerbated that need and also created challenges, but also opportunities for, how to deliver that care.
Tracy Watts, a senior partner and U.S. leader for healthcare policy at Mercer, has urged employers to take a holistic approach when choosing health policies, factoring in mental health services. Watts said when it comes to mental health, she's noticed telehealth has proven to be an innovative tool, enabling providers to deliver services between states.
And now it's really about access. And, we have a real shortage of mental health providers. I think that the telemedicine programs specifically for mental health have become very effective.
For more information about mental health and healthcare insights, visit doseofdialogue.com, where you can listen to the latest episodes and hear from industry experts mentioned in this special edition of the podcast. You can also join the conversation on LinkedIn and Twitter at Dose of Dialogue. Thanks for listening.